The National Endowment for Liberty presents At Issue, the in-depth forum on freedom in America today. Hello, I'm Mike Hayes. The host of At Issue is the physician, author, and former member of Congress, Ron Paul. Ron?
Thank you, Mike. Today we're going to look at the problems of health care and whether the best way to solve them is by imitating other countries or moving in an entirely new direction.
Our program, as usual, will consist of our probe report on what's at issue, reactions from a group of average citizens somewhere in the country, and an in-depth analysis of the entire subject by our panel of experts. We'll begin our probe report, What Ails Medicine?, following this brief message.
This is one in a series of programs that takes a fresh look at critical issues affecting how you live and how you use your natural rights as an individual to make decisions about your life. At Issue is brought to you by the National Endowment for Liberty because we agree with Thomas Jefferson that government governs best that governs least. The National Endowment for Liberty is a nonprofit, nonpartisan educational project. We do not accept state or federal funds. In fact, we don't count on any agency of government at any level to keep this program on the air. Instead, we count on the generous gifts of individuals, people just like you. Write to us at Post Office Box 580099, Houston, Texas 77058, or call us at 1-800-333-3545 and ask for extension 909. If you missed any part of this message, keep your pencil and paper handy. This information will be repeated.
Healthcare in America. Time was we knew it was the best in the world and the best it could be. Now we worry about quality, safety, red tape, and especially cost. Some people think the government should take over. Others think the government is already too much involved. Government involvement in medicine. Is it the cure or the sickness?
Well, the more the government intervenes in the healthcare market, the more that costs get driven up, and the more they slow down the development of low-cost technologies and other things that will improve healthcare for Americans.
Well, the biggest problem is the regulatory paperwork. You're constantly having to create and maintain vast amounts of paperwork in what you do. Of course, the reimbursements are another problem because you don't know from one year to the next or one 6-month period to the next what particular services will be reimbursed. So it makes planning very difficult.
Some people believe our crisis in healthcare could be solved by a socialized program, similar to that in England or Canada.
The system in Canada has a lot of problems. One of the ways that Canadians keep their health care cost dollars down is to restrict access. If you're over a certain age, for example, you can't get dialysis, you can't get open heart surgery.
The American healthcare system has higher quality and provides greater access to critical care, advanced care, high technology care than any other country in the world. In the Canadian system, these are precisely the areas where people are shortchanged. When the government is in control, the government has tight budgets, the government is trying to reduce costs, and they slow down the introduction of new technology, they slow down the purchase of new equipment. You go to your typical American hospital, vastly better equipped than Canadian hospitals, which Canadian hospitals begin to look like old government buildings after a while.
What happens in a socialized system is that the decision makers are going to be bureaucrats and politicians who are driven by votes. And what they need to do is to decide what kind of services should be provided that will keep the most people happy. So you find in England, for example, that the National Health Service pays for ambulance trips, including down to the local pharmacy to get a prescription, or office visits. Ordinary office visits are quite common because most people, voters, can take use of that. Kidney dialysis, though, or kidney disease affects a very, very small percentage of the population, and the treatment is extremely expensive. So those kinds of things tend to get pushed out.
And then at the same time, The system has not proven effective in reducing overall costs. The latest studies show that Canadian healthcare, the costs are increasing at the same rate, just as rapidly as costs are increasing in the United States. And you get the government involved. I mean, are we really to believe that if we turn the entire system over to the government in one big government-run monopoly, somehow that's going to save costs? Our whole experience with government in the United States and around the world has been that's not a great way to reduce costs.
Experience shows socialized medicine systems do not control costs. But clearly, our system doesn't either. What's the real problem?
The real problem in the healthcare system in America today is the rapidly rising health costs. They are increasing very rapidly. And the problem stems primarily from the structure of our insurance system.
We end up encouraging people to buy insurance that has no or very, very low deductibles. So we no longer have insurance anymore. We have prepaid medical care. And we've once again lost the link between what I as a consumer have to, the cost that I pay out of pocket, and the actual cost of the service. So I go out and perhaps spend unwisely or consume unwisely.
What you need is to have those market incentives restored. We ought to move to a system where the worker has the option of buying insurance on his own and receiving a tax deduction, where the worker and the employer also have the option of putting some of the funds that they would spend on insurance in health bank savings accounts, and then buying insurance that is just catastrophic. In other words, backs you up for truly expensive care, and then have the savings in that account available for routine expenditures. Maybe for the first several $1,000s in expenditures a year.
The health savings account plan would work like this. Most of the money a person now pays for insurance premiums would go into a tax-protected account, similar to an IRA. The rest would go to buy an inexpensive, catastrophic insurance plan. Routine health bills would be paid from the special account. Because people would want their accounts to be as large as possible, they would actively seek to control healthcare costs, which today, with private insurance or government programs like Medicare and Medicaid, they do not. The result? Consumer empowerment and a competitive market. Consumers today are virtually powerless in their relationship to the healthcare system. They are generally unable to select options prior to care, and afterwards unable to know whether they have been charged properly. Who can even begin to understand a modern hospital bill?
Well, there might be charges for special beam considerations, special blocks that were built for that particular treatment. It would look like alphabet soup probably to somebody. We have to bill that way because of the way the insurers reimburse for the care.
The costs are really not even directly related to your care. They're a percentage of the hospital's overall costs.
Is there an example from another industry which might show how things work when consumers have real choices?
I think optometry is extremely healthy right now in the 1990s. We have many different factions in the practice of optometry. We have private practice, commercial practice, practice within health maintenance organizations or HMOs, and side-by-side practice with physicians, with ophthalmologists. We're all in a common marketplace competing for the same patients, but doing extremely well by offering varieties of services to those patients.
Today I can go to any mall in the country and find an optician shop right there, even get my glasses in an hour sometime, and have a wide range of choices and lower prices.
You see, optometry tends not to be covered by insurance. It tends to be paid directly by the consumer. So the consumer has an economic incentive to take into account costs and to measure all the factors that consumers do everywhere else in the economy. And the end result is optometry works very well.
There are always, as you've seen in the paper, ads running for specials where you can get your glasses or contact lenses for as low as $25, $30, or as high as several $100s. The price range is quite wide, so people have a lot to choose from, no differently than they do when they go to purchase clothing.
But very differently from when they go to purchase many other health services.
That's true. That's true.
Government-based solutions to the problem, such as national health insurance and socialized medicine schemes, have little to offer in terms of reducing costs or improving the quality of health care. It may just turn out that the uniquely American idea, consumer power in a competitive market, is a much more potent answer to the question of the day: what ails medicine?
Remember when life was simpler and problems were solvable? When you could rely on good common sense and your own honesty and initiative to see you through? That was back before government regulation got so tangled up in our public and private lives, before paperwork and arbitrary rules took over and individual choice was locked out. The National Endowment for Liberty believes that most of our problems cannot be solved by government, that too much government is in itself a problem, not a solution. These programs are made possible as a public service by people who believe that moral and political rights go hand in hand with economic freedom. Write to us at Post Office Box 580099, Houston, Texas 77058, or call us at 1-800-333-3545 and ask for extension 909. We are the National Endowment for Liberty. Liberty can set you free.
We've been 20-plus years on this road. To go into a competitive situation like what's addressed here, it would have to be done almost across the board. How you would go about doing that, what kind of mechanism, would be extremely difficult.
Each week on At Issue, we show the probe report you've just seen to a group of citizens somewhere in the United States. What you're watching are the unrehearsed reactions of people in Houston, Texas, to the probe report, What Ails Medicine?
Medical costs right now are just incredible. If you go in for diagnostic work, it's incredible. But if they had to compete, then they would have to readdress that.
What the film has proven, it is not a better system in Canada or Europe. It has not proven to be a better system as far as cost or health care.
The countries that do have socialized medicine, if you look at the extremely wealthy, like if they have kings or whoever the ruler, if they get extremely sick, they're going to come to the United States to get medical care. And if we were socialized medicine just like them, you know.
I would visualize it if it came into power that you would find more jobs for people, but that would just have an effect of having a more bureaucrat that would do a lot of paperwork, and you'd end up with the tail wagging the dog. It's like the post office system.
We have a problem with the health insurance right now, but I don't see how that could anyway be a solution.
A lot of people abuse the insurance program, and the government sees this as a way to try to introduce this socialized program to try to brainwash us. And a lot of us are smarter than that.
Government programs are designed to buy votes, and that is true of all government programs. Therefore, what has been said around the table is very much true, that any program that the government will come up with will hit the greatest number of voters possible, and yet those of the greatest need will not be covered.
I was living in Louisiana when there was a big debate over whether or not to allow competition in optometrists and selling of eyeglasses and things like that. And I remember when they came in and I saw the cost of eyeglasses just go like that.
I think free enterprise is the way to go.
We still tend to overlook those that cannot afford to be into this type of program. And to address this type of program, you're going to have to address those that can't afford.
Most of the major hospitals will have built into their organization a charitable purpose. This provides for a charitable service. The unfortunate thing is that the costs of operating a hospital have been driven up to such an extent that they can't afford to render a charity. Why? I think it is directly attributed to government intervention into the medical provision area.
When the government becomes involved and this large bureaucracy develops, our costs will not go down, they will go up.
Some strong reactions and opinions from Houston. Now let's see what our panel of experts has to say on the same subject. John Goodman is the president of the National Center for Policy Analysis in Dallas, Texas. Robert Sade is professor of surgery at the Medical University of South Carolina. And our host and permanent panelist is the chairman of the National Endowment for Liberty, Ron Paul. Ron, as a medical doctor, in addition to your other credentials, do you see medical care in decline today?
I would have to say that it is in decline. I started my residency in 1965, the same time Medicare and Medicaid came into existence. And I think over these years of spending time both in medicine and in politics and observing this as closely as possible, I would think that now it's very safe to say that there are more people in need of care, and the cost is certainly higher than ever and out of proportion to anything else. So yes, I think it's on the decline, and tragically what I'm seeing now is that there's a clamor for total takeover of the government on our medical care program. And of course, if a case can be made that government helped create this problem or created the problem, maybe this would be the wrong direction. And I think that's what we want to discuss here today on how are we going to solve this problem. If we had perfect care and nobody's hurting and the cost was adequate and everybody's satisfied, we don't need to do anything, but I don't think that's the case. Somebody wants some changes, and the question is, what are we going to do? I'd like to mention one factor that I'm convinced influences the cost of care, then I want the two panelists to add to this if they can. Over the years, I've dealt a lot with the monetary issue, and you know, cost of everything goes up. If you look at the cost of things 25 years ago, in 1965, a car was a lot less than it is today. So there is inflation. Inflation to me is when the government's out there printing a lot of money and they depreciate the value of the money, the costs are going up. And that's one reason why medical care is up. But if we look at it, we have to admit the cost of medicine is up much faster than medical care. And what do you think some of the other reasons other than inflation? Why are these costs going up like this?
Well, Ron, I think that there are several reasons why the cost is going up. Inflation, of course, as you say, is a very important one, but also you also mentioned the introduction of Medicare and Medicaid in 1965. And if you look at the historical graphs of when the percentage of gross national product represented by health care started to really soar, it was in that year. The injection by the federal government of huge sums of money starting in 1965 really is responsible for a lot of the rise in health care cost. Additionally, I think that a lot of the current very high cost is related to the development of new technologies that in fact are life-saving and are very cost-effective. But from our point of view, I think that the most important, by far, of the reason why healthcare costs have soared seemingly uncontrollably is because people over the last 15 or 20 years have relied more and more on insurance, on third parties to make their healthcare decisions for them. And by the insurance companies spending all the money, making the decisions about how that money is spent, people have in general lost their own sense of incentive to watch costs and to be careful of how much this service or that service is going to cost. I think that by reintroducing a sense of responsibility on the part of individuals that this is their money that's being spent, a sense that doesn't exist right now for most Americans, I think that that would make the single biggest change in controlling the cost of health care.
John?
I agree with that totally. 90% of the time when we enter the medical marketplace, we're not spending our own money at that point. We're spending someone else's money. And we're never going to be as careful when we spend other people's money as when we spend our own. Costs keep rising because there are an unlimited number of ways we can spend other people's money. We could spend the entire gross national product just on diagnostic tests alone.
So it is safe to say then, not only for political reasons, but is there an economic reason that if you pump more money into a system, say the medical care system, the goal, of course, was to have better care and more care. That was obvious what they were motivated by, unless there were a few politicians who were buying votes. You know, they could have been doing that too. But the motivation, obviously, or the explanation at that time was probably we're going to give more care and better care, but they spent a lot more money. Why didn't we get more care? Is it only because the patient lost control?
I think we are getting more care, But since patients and physicians don't have a direct incentive to control the money and make sure that we're getting our money's worth when we spend, now the third-party insurers, both private and government, are intervening, trying to keep us from spending money, and they're intervening into medical decisions. We have third-party insurers telling physicians how to practice medicine, affecting the quality of care. And I'm very, very concerned that the quality of care in the United States is going to go down because these huge bureaucracies are imposing their rules and restrictions on hospitals and physicians.
I have a good example of that from my own practice. I do cardiac surgery in small children, and in order to do that kind of surgery safely, we have to observe those children for a day or two in the hospital before surgery, because if they develop a respiratory infection or something like that, then an operation can be very dangerous. I get a lot of pressure from insurance companies on a nearly daily basis not to admit the patient to the hospital. This is a small baby. I must not admit that patient to the hospital until the morning that the operation is to be done. That is, the patient is going to be in the operating room at 7 o'clock in the morning. That patient cannot come into the hospital until 6 o'clock that morning, an hour before the scheduled operation. That's simply unsafe. But the insurance companies are much more interested in controlling costs than they are concerned for the quality of patient care. So that's a major problem. That's just one small example. It infests all of medical care now.
You know, Ron, I'm going to ask us to hold there for just a second and hold those thoughts while we take a brief break. We'll return to more views and comments on the subject at issue in just a moment.
Throughout this series of programs, you will see ideas examined that affect every part of your life. We'll look at issues from a new angle, not from the left or the right, but from the perspective of individual liberty and responsibility. We believe our founding fathers were right. We are endowed by the Creator with certain inalienable rights, and among these is the right to life, liberty, and property. We do not accept your money transferred through state or federal government agencies. Instead, this series is funded by direct voluntary gifts from individuals. We are the National Endowment for Liberty. Call us right now, 1-800-333-3545, extension 909. For a transcript of this program, specify the subject and send $5 in a stamped self-addressed envelope to P.O. Box 580099, Houston, Texas 77058. The National Endowment for Liberty, providing information on America's most precious resource, individual freedom.
Okay, we're back. We've talked about the problem. The question now, Ron, I guess, is what are we going to do about it?
Yes, we do have a problem. One thing I know about politics is nothing dramatically reverses back to the old way. But I think we have to do something. I think there may be a dramatic leap toward more government if we don't do something. But what can we think about, even under today's circumstances, to introduce a new idea to get people to move in the direction where they would have more control over their health care costs?
I think the most important thing we can do, Ron, is the idea we heard just a few minutes ago about the medical savings account. If we could raise the deductible on a health insurance policy from $250, say, to $1,000, people would save $300, $400, $500 in premiums. $400 in the bank if you don't use it. The next year you have $800, then $1,200. Less money to the insurance company, more money in the bank account of the patient. We empower patients, and bureaucracies then receive.
Okay, one of the arguments will be a lot of people won't do it. Are you going to make it mandatory?
No.
A lot of people will say, well, if they don't do it, then we're going to end up taking care of these people anyway. They won't have any services.
I would not make it mandatory, but what the federal government needs to do is it needs to make it possible for us to do this without penalizing us through the tax system. Under today's system, the federal government subsidizes the premium dollars going to Blue Cross and other third-party insurers, but taxes us if we try to save. There should be just as much encouragement for personal savings for health care expenses as there is to give the money to an insurance company.
But do you think this would be of help?
Oh, absolutely. I think that it's the key to the ultimate solution, which is to create a truly competitive marketplace that currently doesn't exist in healthcare. What we need to do is give people the power to control not only their own healthcare costs, but actually their own healthcare. And the only way that they can do that is to be spending their own money And the best way to do that is through healthcare savings.
Okay, could we do it without closing down all these government programs overnight, or could we introduce them and allow competition and phase them in if they work?
Ron, that's a good question, and maybe one that we ought to wind up on. Our time's really getting short. So let me ask each of you to respond to Ron's point. What do you think we ought to do for the moment, Bob Sade?
I think, Mike, that what we ought to do is to work on legislation to create medical care savings accounts so that people will be able to pay for their own health care with dollars that they don't have to pay taxes on, and will regain control of their own health care and their health care costs, and allow us to begin recreating a truly free market, competitive market in health care.
John Goodman, what do you
I'll
think?
go for the medical savings account and let those accounts build up over time so that for all the small medical bills, we're spending our own money. We need insurance, but only for the really large medical bills. And let insurance play that role and quit trying to intervene in the doctor-patient relationship.
Ron Paul?
Well, I certainly think we need to move in the direction of the marketplace. Government hasn't been known to deliver the mail very well. I don't think they're going to deliver medical care very well. And the sooner we recognize that, the better. Government intervening into the medical profession has pushed all the costs up, and quality has gone down, and less people are getting services these days. So I think it's very important that we recognize that if we have less government, not more government. And yet, right now, I'm frightened to think that people are moving in that direction, but I do believe if they realized that more people can get better care under the conditions of a free market, that more people would opt for that and not be so complacent and dependent and say, leave it to government, let government take care of me. We all know that our government is broken. There's no way that they can take care of us. Freedom has taken care of us in America for a long time, and I think it will continue to do so.
Well, it's a fascinating subject, and it touches all of us, sometimes in places we're not too happy to have it touch. But that's where we'll have to leave it. I want to thank our panelists for being with us and you for watching. And we'll be back next week with another vital topic at issue. The National Endowment for Liberty would like to acknowledge the inspirational contribution of James Miller and the sponsors of At Issue, whose generous support makes these programs possible.